from the station that's on your side. This is Channel 7 News Daybreak.
The time now is 6:23. One of the many advantages of having physicians join our show is that they can share the latest in medical research. And joining us this morning with the newest cardiology findings is Baptist Health cardiologist Dr. Scott Davis. Thanks so much for being here.
How are
as
you?
always. Good to see you.
Good to see you.
Let's talk about, so you guys are always looking for the newest research. You're studying, you keep up to date on this.
Right. So, oftentimes on this segment, we'll talk about, if you've already got heart disease, what do you need to do? Who do you need to get plugged in with? Let's talk about prevention, because that's the thing. It's like, I don't have heart disease and I don't want any of it. So we have a big study that was released earlier this year called the HOPE study. It's the Heart Outcomes Prevention Evaluation, which looked at over 12,000 patients for over 5 years at the basics: high blood pressure and cholesterol.
Okay.
And what they did, they broke them down into 4 arms, and each of the groups either got a blood pressure medicine, a cholesterol medicine, or a placebo combination. Okay? And the take-home message is this: if these folks did not have heart disease, they had no prior stroke, no prior heart attack, no prior bypass surgery, just maybe intermediate risks. They might have been a smoker, or they might have had a family history. And so what they identified was, in the arm that had even low blood pressure elevation going in, 143 was where the cutoff was. Putting somebody on a blood pressure agent significantly reduced their risk over the next 5 years of having an event, of having a heart attack or a stroke. Similarly, if you take all comers, you didn't have to start out with high cholesterol, but if you had a risk factor and were put on a cholesterol medicine, there was a statistically significant difference in lowering your risk over that period of time. And so oftentimes folks will come in and ask, either their family doctor or ask me, hey, look, Dad had a heart attack when he was 52, and I'm just a little bit concerned, but you know what? I don't really want to have to take a medicine, right? I don't want to take a medicine thing, and I get it. But this study is very powerful, and we're getting more of these studies that are coming out now that are showing, by just a little bit of intervention on the front end, getting on a cholesterol medicine, getting your blood pressure addressed, you can really move the direction, move the needle to your favor. And so, like I tell people, it's like moving a battleship, and right now it's a little bit of a change that in the end, over the next 20, 30 years, can make a big impact.
So will this impact how you treat your patients now? Are you changing some things? Will you?
Yeah, so oftentimes what we'll do is somebody will come in the office and their blood pressure will be 148.
Okay.
And then you'll say, you know what, why don't you try losing 5 or 10 pounds? Let's get on an aerobic program in the next 6 months. Let's revisit. Now I'm going to take a little more aggressive, saying, you know what, let's do this. Let's get you on some samples of some blood pressure medicine. And then if you lose weight and if you get into an aerobic program and we see your blood pressure's playing ball, then we can talk about stopping it. But now we've got, instead of it being intuitive, instead of it just being, you know what, I need to lower my blood pressure, I need to get my cholesterol down, and I'm just going to hope that it magically happens.
Right. Now
we've got data that says, you know what, if you get aggressive with it now, you can really impact the outcome.
Proof in the research here. Be open to possibly taking that medicine should you need it. Dr. Davis, thanks so much for being here as always.